Hey, it's your boy Richard Fowler. Catch my show every Friday nights from 8 to 10, only on We Act Radio. It's time that people understand that they need to inform themselves, empower themselves, and get their voice back. That's the only way we can create real change in this country, if we unite together, and that's what we do every Friday nights. We hope you can join the movement with us.
I'm Mayor Bill Ewell. Did you know that 1 in 6 children in our country is obese? Being overweight puts kids at risk for high blood pressure, diabetes, heart disease, and many other diseases. Let's encourage kids in Alexandria to engage in healthy, balanced, and active lifestyles. Reduce their time in front of the TV or computer and get physically active. And we can set an example by being active with them. For more information on preventing childhood obesity, visit usmayors.org/childhood obesity.
Brought to you by the U.S. Conference of Mayors and the American Beverage Association.
You're listening to WPWC We Act Radio, 1480 AM, weactradio.com.
Yo, you already know what it is, what it was, what it do. It's your boy, Cyrus the Virus, a.k.a. the livest animated rapper out here in the D.C. area, man. Down here on Georgia Avenue, Northwest, Washington, D.C. at We Act Radio. Do something, please.
Hi, this is Chris Hedges, and when I'm in Washington, I don't want my news filtered through corporate sponsors. I want to hear the truth, which is why I listen to DC's only independent radio station, We Act Radio, 1480 AM, WPWC, Washington's progressive working community. We Act Radio, do something.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
They were saying when they think you cannot hear. If you understood what they do, if for you it was so clear. If you knew they shut down the factory in an economic ruse. If you could kiss the cheek of the child in the sweatshop that made your shoes. Every time we went to war to fight our evil foes, they told you we were really fighting for the good of CEOs. If you could feel the hunger of the many, see the riches of the few. If they told it like it is, what if you knew?
You're listening to Clearing the Fog, speaking truth to expose the forces of greed with Margaret Flowers.
And Kevin Zeese.
And we're excited again about our show. We're always excited about our show.
It's a good show on healthcare, and I love the Strike Debt.
Life or Debt.
Life or Debt. Strike Debt's new campaign to erase some health debt, which is great.
Yeah, but first let's go over a few quick news things.
Okay.
You wanted to talk about the sequesters?
Well, I mean, everyone's talking about the sequester. I think the thing that's not being talked about really is what we're getting into. We're kind of like the frogs in the warm water right now, the warm sequester water. And, right now no one feels anything. But and it's kind of like the politicians are waiting for people to feel the pain. But by the time people feel the pain a month or 2 months from now, it's going to be too late. We're going to see the GDP shrinking. We're going to see the unemployment rising. The double-dip recession will be in full flow. I mean, we already had a shrinking GDP in the last quarter and rising unemployment in the first month this year. So this sequester comes exactly the wrong time, but the politicians in Washington are not doing anything until people feel the pain. By then, the damage will be done.
Right. It'll take us a lot longer to recover.
A lot longer to recover, so that's a real depressing thought.
Well, what a nice thing to talk about. Okay, so more good news.
More good news.
Ernest
Moniz as the Energy Secretary, MIT funded by the oil and gas industry, and he's a big fan of fracking, big fan of nuclear power. He's part of the all the above mistake that Obama's making that's going to bring us climate change. And looks like he's going to be he's going to be announced today as Energy Secretary, even though environmentalists oppose it. And it comes on the heels of another disappointing but not surprising decision by the Obama administration. The not quite a decision, a draft environmental impact statement on the Keystone XL pipeline. And that's going to be, a done deal soon, I'm sure. And it'll probably take a few more months to get public comment in, and those kinds of steps I'll go through. But in the end, I think the result is pretty preordained. It's going to take a fight on the ground, as we've been saying on the ground in the Midwest where the pipeline's being built.
Right.
Direct action to resist this climate bomb that they're tapping into.
And we'll be writing more about the fracking. Well, we've already written it. It'll be published this week in Truth Out, our article from last week's show on fracking. And
on Wednesday.
And then what I found interesting about the draft the environmental impact statement on the pipeline was that they were saying that they think that the pipeline will have minimal impact on the environment. They think leaks will be few and far between, but that's been far from the case.
And they've even
in Canada.
That's right.
They already built the pipeline. They had 12 leaks
in the first 12 months. That's right. And then tar sands blockades taking pictures from inside the pipeline that show light
holes
coming through.
Yeah,
that
and
show
we
holes.
spoke to an engineer who worked on pipelines who told us that those small holes
become big holes.
Well, they can release a lot.
That's what I mean.
A lot of materials,
become,
right?
Big holes. And of course, the draft environmental impact statement does not look at the impact on climate change of tapping into the Alberta tar sands.
Alberta tar sands, right?
They take that out of the equation in order.
That's not in our country. That's in another.
Well, they want to get the result they want.
Exactly. And just last week there was a pipeline that burst in East Texas, wasn't it?
That's right.
That spilled 20,000 gallons before. The sensors on the pipeline did not pick up the spill. It was when the residents in that community discovered it and contacted them that they knew there was a spill. So
sensitive sensors.
Yeah. So anyway.
Bad environment. We're going to have an article, in fact, this week on our Occupy Washington, D.C. site, our weekly newsletter, that'll be focused on the gangrene of the traditional environmentalists who are kind of taking money from industry, sitting on government boards, and providing an imprimatur of approval to a lot of these bad policies, versus the new environmentalists who are really the direct action folks who are taking real action to try to stop these kinds of fracking and tar sands and pipelines and being very aggressive and strategic about it. So it's an interesting time.
Yeah, it's very interesting. But let's jump into our show. We're very fortunate this morning to have with us Thomas Gokey. Thomas is a visual artist and adjunct professor at Syracuse University. Of interest, one of his most recent projects is in transforming his debt from art school into a work of art made out of the exact same amount of real money, which he is selling for the price of his tuition debt.
Wow.
Very creative.
I like that one.
And he's part of Rolling Jubilee, a collective project with Strike Debt, and that's what we want to talk today.
I love Rolling Jubilee.
Is medical debt. Good morning, Thomas.
Good morning. Thanks so much for having me.
Thanks for joining us. Just to begin with, can you tell our listeners a little bit about Strike Debt, about how it came about?
Sure. Strike Debt formed in May in New York City, emerging out of Occupy Wall Street. One of the things that we realized very early on in the occupation was that debt is one of the ties that binds the 99% together.
That's right.
We met each other. We met each other in the park, and we realized, oh, you have massive crushing debt because you went to school. Oh, you have massive crushing debt because you had this health emergency and you didn't have insurance. Oh, you lost your house in the housing crisis. And so from the beginning, there had always been a lot of discussion about how debt functions in our economy. And Strike Debt is looking at ways to organize debt resistance in various forms. It's an umbrella term that covers a diversity of tactics. And the way I see it is that last year the way to resist was to go into your public squares and use your First Amendment right to peacefully assemble. And then they just decided to suspend those rights across the board and these illegal evictions from the park. And now we're looking at what are the other points of contact between Wall Street and our lives, and debt is one of those points of contact. Every month when we pay our debts, we are cooperating with the system, and can we innovate new forms of non-cooperation? So that's what Strike Debt is about. It's been going strong in New York since last May, and it now has affiliate chapters springing up all around the country and around the world.
And Rolling Jubilee was one of the tactics of Strike Debt?
Yes, it is one of the tactics, and what Rolling Jubilee does is many people don't know how debt actually functions, and one of the strange, bizarre things about how it functions in the United States is that banks actually buy and sell debt like a commodity. It's a little bit of somebody's life. It's a little bit of their misery, but they'll put a price on it and they'll sell it just like it's wheat or corn or anything else.
Right.
And the catch, the thing that makes Rolling Jubilee work, is that when banks sell this debt on the secondary market, they sell it for a tiny fraction of its face value. So if you, for example, went to the emergency room and wound up with a $5,000 medical bill that you weren't expecting to have and you can't pay, that hospital will sell your $5,000 medical bill to a debt collector for maybe 2 or 3% of that face value. And then the debt collector will turn around and try to harass you until they get the full amount, or as much as they possibly can. So what Rolling Jubilee does is it intervenes on the secondary market. We buy that debt at the same price that it's being sold to debt collectors or to other debt speculators. And rather than collecting on the debt, we just abolish it, because our position is that this debt never should have existed in the first place. This is illegitimate debt. Nobody should have to go into debt or go into poverty or potentially go bankrupt or lose their house because they have basic needs, like the need for medical care. So we're just wiping out this debt.
Wow.
That's great. And so how'd that work, that first round? You started that in the fall, I think, and started to pay all people's bills around Christmas?
Yeah, we launched the project in mid-November, and first we needed some money to go out and buy the debt, so we raised over $500,000 in November.
Wow.
And then the task was to start buying these portfolios of debt. And our first one, we started out pretty small. We spent $5,000 to purchase a little more than $100,000 worth of medical bills in upstate New York. And in a couple weeks, we're going to announce the specifics for our next portfolio of debt that we've purchased, which is much, much bigger.
Great.
And gets into like the 7-figure range of medical bills that we'll be able to wipe out. So one interesting tidbit about that first batch of debt that we announced around the holiday season is that this was actually debt that came from a hospital in upstate New York that itself went bankrupt. And we're seeing this happen all across the country. The latest wave is that these hospitals are being shut down and consolidated into these giant behemoth hospitals that don't provide as high quality local care, and that also have some strange quirks in how their finances work, where you get CEOs that are making 7-figure salaries that all come from people being stuck with these medical bills.
Well, I mean, we've seen the same thing here in Washington, D.C., where private corporations come in and take over community hospitals, a city-owned hospital, and they just 3 times in a row, a private corporation came in and ran that hospital to the ground, basically looted it because they knew the city would bail it out each time.
Now it's a nonprofit and seems to be doing better. So hopefully it'll keep going that way. Well, the city wants to take the property for Homeland Security people. So
to build a gated community for the employees. Anyway,
let's stay on strike debt.
So did you? I mean, this is tremendous. When you abolished the debt back in December, did you actually have any communication with the people whose debt you erased?
Yes, we're notifying people by mail that their debt has been abolished, and that first wave was a fairly small sample size. It was about 44 people. And so we're hoping with this next batch, which gets into a few thousand people, that we will have a few people who are willing to come forward and talk about their experiences. We're not putting any pressure on anyone to do that. It has to be their own decision. But I think the more people that we can abolish the medical bills for, the greater chance it is that we'll be able to hear a little bit about their experience.
Yeah.
That's a great, I mean, really what a great concept. And I look forward to seeing how this plays out.
Yeah.
So you'll be announcing this new campaign in a couple weeks?
Yes, we're going to be making the announcements, the specifics about which city and the exact amount of debt and the exact number of people in a couple weeks. And then later on, March 16th to the 23rd, we're announcing national actions around healthcare. So, for example, in New York City on the 23rd, there's going to be a rally in Washington Square Park at 2 p.m. Where people can come, and there'll be education, there'll be a march, there'll be an opportunity for some direct action. In the morning on the 23rd, we're also hoping to organize some health fairs for people who can't see a doctor, who need to see a doctor. We're trying to arrange for some private screenings.
Excellent.
So if people want to get involved, they can email rjaction@strikedebt.org, especially people in the healthcare profession who want to come and help provide these free screenings. Please get in touch with us. But if anyone who wants to come and help learn about how messed up our healthcare system is and how messed up our debt economy is, meet us in Washington Square Park at 2 p.m. on March 23rd.
That's excellent. You know,
it's a great thing, especially with health debt being a leading cause of bankruptcy.
Right, which we're going to get into in the second half with Dr. Steffie Woolhandler. But in Maryland, we've decided to do on the first day of spring, March 21st, actions throughout the state of people having rallies, holding up signs, handing out literature about medical debts.
Great educational opportunity.
Yeah,
we're going to definitely be pushing a lot of people to join in and do that in their hometowns too, around the country. So we have a good list of healthcare activists that we're going to be pushing on that.
Right, now we need to take a very quick break. And then we want to come back and talk more about strike debt and how people can get involved into this. So the song that we're going into this break with is by Norman Sebastian. It's called Healing the Healthcare Blues. It's great. Heal the healthcare blues. That's what we're trying to do. Heal the healthcare blues. It's up to me and you.
You're listening to WPWC, We Act Radio, 1480 AM, weactradio.com.
Hi, I'm Tom Morello. Some call me the Night Watchman. In the case of Mumia Abu-Jamal is at a crucial stage. Please go to freemumia.com to find out more information about how you can help Mumia Abu-Jamal and other political prisoners. Night Watchman out.
June 27th is National HIV Testing Day.
HIV testing is fast, painless, and often free.
I've been tested for HIV.
I've been tested for HIV. Have you? To find an HIV testing center near you, visit greaterthan.org.
Hi, I'm Patrick Ewing. I'm here giving something back to the community. I went to school here. I lived here in the community. You know, I have an office here on Minnesota Avenue. I always loved D.C., you know, just trying to give something back to the community of Ward 8 in this community or from around the country. We Act Radio, do something.
Nobody out. That's what it's all about. Everybody in and nobody out. It's up to me and you. Kill the healthcare blues. That's what we're trying to do.
Absolutely. You're listening to Clearing the Fog, Speaking Truth to Expose the Forces of Greed with Margaret Flowers.
And Kevin Zeese, and we're talking healthcare debt.
With Thomas Gokey from Strike Debt Rolling Jubilee. So you mentioned in the first segment that there are now states around the country, and I guess you said around the world, people are forming their own strike debt chapters. Can you talk about that?
Yes. We've got very active strike debt chapters in the Bay Area, in Philadelphia. I just visited some people involved in strike debt in Detroit, big chapter in Chicago. It's hard to keep track of all of them.
That's great.
They're all coming together and starting to analyze how debt functions in their cities. For example, in New York, the MTA is about to announce another rate hike, a fare hike, and this is largely a result of municipal debt, that they have to increase the amount it costs to ride the trains in order to pay Wall Street for these municipal bonds. So it's not actually that the MTA needs more money to run the trains, it's that they need more money to pay this debt. And so cities are coming together and learning how debt functions in their city and different ways that we can start to intervene at this point of contact between our lives and Wall Street.
So if somebody sets up a local Strike Debt chapter in Chicago and wants to relieve debt in Chicago, they can buy debt just like a debt collector would and do that in Chicago?
Well, it doesn't quite work that way. The Rolling Jubilee as a project really is a national project. I mean, we're buying debt everywhere. We're not encouraging people to start their own local Rolling Jubilee, rather find ways to support the national one. It's not really possible to reverse engineer who gets bailed out. I mean, before we purchase the debt, we don't know whose debt it is we're buying. And so we can, to a limited degree, focus on a geographical area, but you need a large amount of money before you can find portfolios in that range. So if a local chapter were able to raise $5,000, they really would have a hard time finding $5,000 worth of local debt. But what we can do is, we're going to be announcing a large amount of debt that has been abolished from a city that I don't think there is a strike debt chapter in that city. So we're hoping that the Rolling Jubilee can plant one firmly there, and it'll sort of be like a reverse process. We abolish the debt first, and hopefully that will bring out debt resistance in that.
Very creative, very creative.
That's fantastic. So it sounds like the local chapters are more focused on education. So are there sources that they can go to learn more about the process of finding out how debt affects their communities?
Yes. I would encourage everyone to go to the Strike Debt website, which is just strikedebt.org, and download the Debt Resisters Operations Manual. We actually researched and wrote a manual about how debt functions, how you can protect yourself, and how you can fight back. It's about 120 pages. It's got an entire chapter on medical debt. At the strikedebt.org website, you can also download the Strike Debt Organizers Kit for people who want to start their own Strike Debt chapter. It gives them sort of ideas about how to go about doing that, how to organize a debtors' assembly. So I can't tell you how fantastic the Debt Resisters Operations Manual is. It's unlike anything else out there about debt. You can find a lot of how to get out of debt, self-help type books, but there's really nothing else that's how to actually resist debt.
That's tremendous.
That's excellent.
Yeah, it really is. And I think for our listeners, I mean, it's as simple as, I think if a person is interested, they can learn more about this, maybe get a few friends together and just start talking about it and build it from there. It's not hard to do, right? So can we talk for a minute kind of about debt collection in the U.S., because this has become a huge money-making industry. And I remember reading recently a report that when people challenged the debt that the collectors were trying to collect from them, in many cases the collectors didn't have real solid documentation that the people actually had this
the debt.
Yeah,
that's right.
Is that something that you can talk about, Thomas?
Yes, it's a huge scandal that when this debt is bought and sold on the secondary market, there really isn't the legal paperwork there to prove that this debt is even rightfully owed.
Wow.
And it happens differently in each state and in each city even, but it's crazy the way that debt collection and debt buying functions in New York City, for example. Debt buyers have actually removed the constitutional protection for due process. So they'll buy the debt, and then they'll take a debtor to court to seek a judgment for them, and they won't inform the debtor that they're supposed to appear in court.
Wow.
And that's legally required, but they just skip that step, where they intentionally use what's called a sewer service. These people who deliberately don't serve papers to the debtors. And so when you arrive in court, the debt buyer is there, the debtor doesn't show up, and the judge just rubber stamps everything that the debt buyer wants to do. They give a default judgment without reviewing any of the facts, without forcing the debt buyer to prove that this debt is actually owed. And then once they get a default judgment against the debtor, they can actually start docking people's wages, they can seize bank accounts, they can dock Social Security.
It's crazy.
And
corporations are people. People don't have people rights when it comes to debt.
And this is one of the things that just makes me outraged.
Yes,
is that corporations can always get their debt abolished. I mean, the same protections that are in place for corporations just don't exist for regular people. Corporations can file bankruptcy even when they have all the money to meet their obligations. They can file bankruptcy and get their debt abolished. Same thing isn't true for most ordinary Americans.
Right.
Insane.
It is. The more you learn, the more, you know, what was, we just wrote an article last week, Time for Outrage.
Yeah.
After the death of Stefan Hassel.
Well, we'll be writing about this as well, so we hope we can create some outrage on this, too.
So, now, to move on kind of internationally, I know in Spain they've launched a program called No Pagamos, We Won't Pay. It's a little bit different. What they're actually talking about there is the national debt that the government has accrued. They don't feel that it wasn't their debt. They didn't cause it, that they should have to pay for it. Do you know much about the movement that's going on there?
We know some. There are members of Strike Debt who are really trying to build these alliances internationally, who know a lot more about the specifics of how it works. But there's some really innovative stuff going on in Spain, in Greece, in England, and we're, you know, it's different in each location. I mean, in Spain, it's a lot about this sovereign debt, this national debt. In the United States, Congress is using this national debt, which is largely a result of tax cuts for the rich and wars that were just paid for on the credit card. And they're using it as this giant alibi in order to cut social services like Social Security and Medicare.
Right.
When in reality, you know, none of them actually care about reducing the national deficit. They're just interested in tax cuts for the wealthy and cutting services from the poor. If you actually wanted to address the national deficit, single-payer health care would save $400 billion every single year.
That's right.
$400 billion with a capital B. So
it's the obvious solution that just won't be considered in Washington, D.C.
I mean,
the public wants it. 2/3 Americans support it.
You and I actually argued before the National Commission for Fiscal Responsibility and Reform. We testified in front of them.
The Peterson-funded Obama Commission.
In June 2010, and we made that argument. We turned in our papers. We testified at the hearing. They didn't seem to do anything with it.
No. Well, it's not their agenda, as Thomas says. It's not their agenda. You know, you just saw Kerry in Egypt this weekend, pushing the Egyptians to make a deal with the IMF, cut their food subsidies, their energy subsidies, so they can get a loan from the IMF, and the financiers of the banking system worldwide will be willing to come back to Egypt and give them some money. So, it'll get them in debt, and they'll be in the same kind of situation that Greece and Spain find themselves, and other countries have. The only right path for these countries is to say, forget it, we're not paying this debt.
Right, and to invest in local needs, in jobs. I mean, full employment is really the answer as well.
Well, for the United States, that's certainly the answer, is focusing on employment. That will solve the deficit crisis real quickly.
Yeah, but we're getting off track. So
anyway.
Yeah, we just have a few more minutes with you, Thomas. Do you want to tell us more about other kinds of projects that Strike Debt is doing? Can you talk about some of the other tactics that are being used?
Sure. One thing that I'm really interested in, I'm hoping to see different local Strike Debt chapters start these as little experiments. One way that payday lenders, some of the most egregious forms of loans with like 300% annual interest on these small loans. One of the main ways that they make money is through charging people to cash a check. So people who live paycheck to paycheck, where when they get their weekly paycheck, it's already spent. It's already dedicated to food and to different bills that they have to pay. So they don't actually have a bank account because they would never even be able to meet that minimum amount that you need in the bank account before you get charged. But it costs money to cash a check.
Right.
It doesn't have to cost money to cash a check. If somebody came to me as an individual and said, would you cash this check for me? If I have a bank account, I could do that free of charge. So I would like to arrange for local credit unions or churches to create these zero-fee check cashing services that would keep money out of the hands of these payday lenders. It's only one source of their money, but every little bit counts. Even these payday lenders, even this in an industry that's designed to rip people off, they've got enough overhead that if you can slice away at that, it makes it a less viable business.
That's a tremendous idea. I love that idea.
Yeah. So, what's the overall goal of Strike Debt? What is the idea to end the debt system, or what's? I mean, we don't have much time to get into this, but I wish I asked it earlier.
Yeah.
So, what debt fundamentally is a kind of bond that you have with other people. It's a kind of social bond, and so I am genuinely bonded to you, even though we don't know each other. I'm bonded to you. There are certain obligations that I feel towards you. You should be able to meet your basic needs with dignity. You should have health care. You should be able to go to school without taking on decades worth of crushing debt. These are things that obligate me to you. So these are the kinds of social bonds that we want to create with one another. These are the good kinds of debt that we want to create. What we want to reject are these illegitimate debts that we owe to Wall Street, because we can meet all these obligations. We can afford to pay for 100% publicly funded education, which would cost, it actually costs the same amount of money that the Pentagon loses every year. The Pentagon has an audit every year, and they just say, well, there's a certain chunk of money that we know we got from the taxpayers. We don't really know what we did with it. That same amount of money could pay for every public 2- and 4-year school. So we can meet these obligations. It's just
if we weren't a Wall Street dominated government that puts big finance at the heart of our economy and makes them profit off everything that we do. That's the bottom line problem, and we need to go into this in more detail with Strike Debt at some other point to get beyond this, because we're over time. Yes.
Okay, Thomas, thank you so much for joining us today. And
StrikeDebt.org.
Keep up the great work, and we're going to go into this break with one of our favorite songs. We're number 37.
37 in what?
In health.
Healthcare.
Outcomes,
yes.
In the world. Not number one.
Well, I was starting to see where the problem lay and why I was having to pay and pay. I said, this isn't really about my health. It's something to do with increasing your wealth. They said, what country do you think you're living in? Cuba? France? England? Germany? Taiwan? Brazil? Hungary?
You're listening to WPWC, We Act Radio, 1480 AM, weactradio.com.
I'm Gary Johnson, former governor of New Mexico. Last year, my state became the 12th state to allow medical use of marijuana by patients who are seriously ill. Some people were surprised that a Republican governor supports medical marijuana, but I'm hardly alone. Groups like the American College of Physicians, American Nurses Association, and American Public Health Association have all acknowledged the medical value of marijuana. New research about medical marijuana is coming out almost every day, showing remarkable potential in all sorts of serious conditions, including cancer, AIDS, and chronic pain. But some in government still want to put politics and ideology ahead of public health. To learn more about medical marijuana and what you can do to help, contact the Marijuana Policy Project at 1-877-JOIN-MPP or visit them on the web at mpp.org. Thanks.
This is Kimon Freeman, host of Speak Easy and co-founder of We Act Radio. Suicide is a very serious problem in today's challenging world, whether with our troops abroad or with everyday citizens within our own society. Before you take your life into your own hands, tie a knot at the end of your rope and call the suicide hotline toll-free at 1-855-320-LIFE. That's 1-855-320-LIFE. It may just be the most important call you ever make. You talk, we listen, and together we survive.
It's like a jungle sometimes. It makes me wonder how I keep from going under. It's like a jungle sometimes. It makes me wonder how I keep from going under.
Would you like to secure stable employment, affordable, high-quality child care, or an opportunity to serve your community through meaningful volunteer and internship experiences? If so, UPO is the place for you. Hello, I'm Andrea Thomas, Vice President of Administration and Chief of Staff for UPO. As the Community Action Agency for Washington, D.C., UPO has proudly served the residents of Washington for the past 50 years. Annually, we impact the lives of nearly 100,000 Washingtonians, 100,000 people advancing their education, securing employment, maintaining housing stability, and investing in their communities through volunteerism. Our vision is a Washington of thriving communities and self-sufficient residents. To learn more about our services and how you can partner with us or donate, visit us at www.upo.org. UPO, where we are uniting people with opportunities.
You're listening to We Act Radio, WPWC 1480 AM. Now get out there and do something.
New Zealand, Australia, Denmark, Norway, Chile, South Korea, Uruguay, Luxembourg, Liechtenstein? Well, the truth is, with expectations like that, you could be living in any industrialized country in the world except for these United States, where there's 47 million of us out here on our own.
There we go. You're listening to Clearing the Fog, Speaking Truth to Expose the Forces of Greed with Margaret Flowers.
And Kevin Zeese.
And in the first half of the show, we were talking about Strike Debt Rolling Jubilee, which is about to announce the relief of a very large amount of medical debt, which is fantastic.
Great program.
For this section, we want to go a little more into the heart of why medical debt exists in this country. And to do that, we have Dr. Steffie Woolhandler.
Excellent guest.
She's a primary care physician and professor of public health and medicine at CUNY School of Public Health at Hunter College. She is a co-founder of Physicians for a National Health Program and author of several leading academic studies on medical bankruptcy. Good morning, Steffie.
Good morning.
Thank you for taking time to join us.
We could talk to Steffie and her partner, David Himmelstein, for a long time and not get bored.
No, you have so much knowledge to share with us. Can we start out, Steffie, just with describing for our listeners why medical debt exists in this country? How do people get into medical debt? Why does that happen?
Well, some people get into medical debt because they have no insurance and then they get sick and have to spend money. But the majority of people with serious medical debts have insurance, but their insurance is only partial. It's full of gaps like co-payments, deductibles, uncovered services. So people get sick, they try to use their insurance, and they find that they're still left holding literally thousands of dollars worth of unpaid medical bills.
And you've done studies on healthcare and bankruptcy. What have those studies found?
Right. Well, we interviewed more than 2,000 people in federal bankruptcy courts to figure out why they went into bankruptcy. And in about 60% of all personal bankruptcies, medical bills and medical illness played a major role. So either people were uninsured, got sick, or they were insured, but found that their insurance really failed them when they had a serious and expensive illness.
I think it was, wasn't around 78% of those who went into medical bankruptcy or had a bankruptcy due to medical reasons they had insurance at the beginning. Is that correct?
Right. More than 3/4 of people in medical bankruptcy had health insurance, at least when they first got sick. Now, some of those people got so sick they lost their job, or they had to quit their job to take care of a sick family member, and when they lost their job, they lost their insurance. But even more commonly, people had insurance, usually private insurance, that they kept throughout the medical illness, but were bankrupted anyway because of the gaps in coverage, like co-payments, deductibles, and uncovered services.
Right.
And how's that going, the direction of co-pays and uncovered services? Is that something that we're going to get improved as Obamacare takes hold, or is that something that's becoming more common?
No, in fact, Obamacare will make the problem of gaps in coverage much more serious, because the required policies under the Obamacare legislation are extremely skimpy. The so-called bronze policies, which are the cheapest policies that will meet the mandate under the Obamacare, will only cover about 60% of your expected medical costs. People will buy those plans but still be responsible for 40% of total medical care costs, typically at least $6,000 per person in out-of-pocket medical costs every single year. That would be for someone who actually got sick and tried to use their insurance.
Right.
So this is really the first time that the government has put their stamp of approval on these extremely skimpy policies. In the past, some states were trying to put in consumer protections and were trying to regulate the insurance market to make the policies more generous. But Obamacare really reversed that trend, with the federal government stepping in and saying one of these bronze policies that only pays 60% of your costs, one of those is just fine with us as the federal government. We think that's okay. So the Obamacare actually in some ways made the problem of underinsurance worse. It does improve the problem of being completely uninsured. We all know that. Approximately half of all currently uninsured people will receive coverage under Obamacare. About half of them, or 30 million people, will remain uninsured. But when we get to the problem of underinsurance, people with only partial coverage, Obamacare actually makes that situation worse.
Right.
And I think the subsidy under Obamacare is only for the 70-30 plans, when the 70%, they call them the silver plans, I guess, and 70% is paid for by the insurance company and 30% by the consumer.
Of covered services.
Of covered services, that's right.
Right.
Yes,
Yeah.
yes. And for whatever reason, the subsidies are only available if you purchase at the silver level. And if you're the subsidies phase out at about 250% of poverty. So at a relatively low income, some of the subsidies for co-payments and deductibles disappear.
Wow.
I'm looking at the cost of premiums. It's difficult at that level of income.
Oh, it's insane.
Part of
it's not. It's more than difficult. It's just not possible.
Right. So there's a lot to talk about, but first, can you talk a little bit about what the impact is on our health when we have these financial barriers to care? How does that impact health outcomes?
Well, there's a tremendous body of research saying that when people have no insurance, they don't get preventive care, they don't get primary care. When they have a serious illness and go to the hospital, they have much worse outcomes. They're more likely to die. There's a growing body of evidence that people who have insurance but have these skimpy policies, these so-called underinsurance policies, also face really bad health consequences. When people have skimpy policies, they delay getting primary care, they delay going to the hospital, and they often have worse outcomes than people who have full coverage. So we need a system where everybody has coverage for all medically necessary care, because that's really the only way to assure people get the care they need, and it's the only way to really protect the budgets of American families from the very high cost of illness when a serious illness hits.
Absolutely.
So how does this compare to other countries around the world? The U.S. system that's got this underinsurance and lack of insurance. How does that compare to the rest of the world?
Well, many countries have systems that cover virtually 100% of all medical care. So in Canada, traditionally people have 100% coverage of hospitals, 100% coverage of doctors. Certainly in Great Britain, there's a tradition of really 100% coverage for many people. Some of the European countries do have co-payments. However, in those countries, they have much more equal income distribution. Right. So they don't have the huge group of very poor people that we have here, or even low-income people like we have here who just don't have the cash in their pocket to pay the co-payments. And we have like a bad situation with a lot of income inequality, lots of people who are just barely getting by on their paycheck, and then healthcare costs, which even if you have insurance can run into thousands and thousands of dollars out of pocket every year.
Yeah, as we see the middle class getting poorer.
Absolutely.
At the same time that these new healthcare underinsurance plans are coming into effect, it's going to be a bad mix.
Yeah, well, I think this is a big, the underinsurance is actually a very big hit on working families.
No
the people
question.
who are living paycheck to paycheck, but
That's
they're
right.
getting by, they're making it work, and then something like an appendicitis or a bad car accident will sink the families and push them into bankruptcy. So one of the things that could really improve the financial security of working families would be if insurance really covered everything.
Right.
Well, we'll get into the solutions in the next segment.
Which we have to go to a quick break right now.
Now we're here the 37 song.
This is the number, yes. The last song was called Talking About Healthcare by Deborah Van Cleef, but this is by Paul Hipp. It's called We're Number 37. And we're number 37. We in the USA. Big number 37. And we're so proud to say we're number one in tanks, we're number one in planes, we're number one in war with number 2 for brains and body. We're number 37. We're in the USA.
You're listening to WPWC, We Act Radio, 1480 AM, weactradio.com.
I'm Mayor Bill Ewell. Did you know that 1 in 6 children in our country is obese? Being overweight put kids at risk for high blood pressure, diabetes, heart disease, and many other diseases. Let's encourage kids in Alexandria to engage in healthy, balanced, and active lifestyles. Reduce their time in front of the TV or computer and get physically active. And we can set an example by being active with them. For more information on preventing childhood obesity, visit usmayors.org/childhood obesity.
Brought to you by the U.S. Conference of Mayors and the American Beverage Association.
This is your boy, Richard Fowler. Catch my show every Friday nights from 8 to 10 on We Act Radio, 1480, or weactradio.com.
Hi, this is Chris Hedges, and when I'm in Washington, I don't want my news filtered through corporate sponsors. I want to hear the truth, which is why I listen to DC's only independent radio station, We Act Radio, 1480 AM, WPWC, Washington's progressive working community. We Act Radio, do something.
France. You're listening to Clearing the Fog, speaking truth to expose the forces of greed with Margaret Flowers.
And Kevin Zeese.
And our guest right now is Dr. Steffie Woolhandler. Steffie, before you moved to Hunter College, you were in Cambridge for a long time in Massachusetts. Can we talk a little bit about the health law that was passed there in 2006? Because it's very similar in a lot of ways to the current federal health law.
How's that working out?
Yes, certainly the Massachusetts law was the model for the national plan. Well, in Massachusetts, the new law cut the number of uninsured by approximately half, which is what is expected to happen nationally. But you still have about half of the uninsured still around and with lacking insurance. The problem is that after the law, a lot of the services that were available free for the uninsured have been cut, so that safety net funding was reduced by the law. And again, that's going to happen with Obamacare. There's about $36 billion in cuts to safety net hospitals contained within Obamacare. So there'll still be uninsured people, 30 million of them after Obamacare is fully implemented, but the safety net institutions to care for them will be starved of funds. So while some people may be better off under Obamacare, certainly some folks who are remaining uninsured will be significantly worse off under the Obamacare legislation.
And so basically they cut those safety net programs in order to subsidize private insurance. So we're taking money from public health to premium subsidy.
Yes, that's what's going on. And the safety net institutions are not just there for uninsured people.
Right.
That's very important. But safety net institutions also take care of patients with insurance who can't get care in the private sector. For instance, people with mental illness problems, people with substance abuse problems may not be welcome in the private sector regardless of their insurance. Those folks may have to seek care in the safety net, and those safety net institutions have seen their funds taken away and given to private insurance under the Massachusetts law and also under the Obamacare legislation.
And I've also seen in Massachusetts there's also less use of health care because of the co-pays and the out-of-pockets, and that health care costs have not been controlled.
Oh, well, the health care costs have absolutely not been controlled, despite the fact that then Governor Romney claimed that the 2006 reform would control health care costs. Massachusetts healthcare costs are the highest in the nation and continue to rise very rapidly and continue to be the highest healthcare costs in the nation. In fact, they're pretty certainly the highest healthcare costs anywhere in the world.
Wow.
Wow, yeah, that's amazing. And so we also understand that the financial barriers to care in Massachusetts continue to be quite high. You did a study, I think, was it just a few years ago, looking at bankruptcy in Massachusetts. How's that been impacted by the law there?
Yeah, well, medical bankruptcy in Massachusetts still accounts for about half of all bankruptcies. That was true before the 2006 legislation went into effect, and that was true in 2009 after the legislation had been around for a couple of years. So it's pretty clear that what was done in Massachusetts didn't impact the problem of medical bankruptcy in any significant way. And if you look at what the insurance is like in Massachusetts, it's pretty similar to what will occur under Obamacare. That is, this very high co-payments and deductibles. If you go on the exchange website, it's actually called the Connector in Massachusetts, you can look and see the cost of a policy for someone in their 50s and also what the co-payments and deductibles would be. And the premium for someone in their 50s would be about $5,000 per year, but then that policy would come with a $2,000 deductible, so if you get sick, you're $7,000 out of pocket before the insurance pays a single penny. And then thereafter, for the next $15,000 in spending, you as a patient are responsible for 20%. So, and this can recur.
That sounds better than the Obama plan.
Year after year after year. Yes, actually, it's a little better than the Obama plan. The plans in Massachusetts actually are a little better than what we can expect under Obamacare.
Wow. So what are the solutions?
Well, actually, can I ask one more question?
Okay, go ahead, because we're already 8 minutes left.
Okay, a lot of people are talking about the exchanges kicking in October, and how these are actually going to control healthcare cost of premiums. How are the exchanges functioning in Massachusetts? Are many people buying their insurance through the exchanges? Is that bringing the cost of premiums down?
No. People who have a choice about whether to buy in the private market or the exchanges, very few of them are actually using the exchanges. A few thousand are, and often those few thousand people went to the exchange because they could get a better deal at the exchange than privately. But the hundreds of thousands who continue to purchase health insurance without going to the exchange, apparently found that they did not get a better deal through the exchange. That
How interesting.
No particular cost savings. The exception, of course, is anyone who is on the subsidized plans, which in Massachusetts are only up to 300% of poverty, or about $32,000 income for a single person. People who are eligible for subsidies must go through the exchange. So in that group, obviously, a very high percentage of everyone who's got insurance has been going through the exchange. But above 300% of poverty, where people have a choice, the exchanges have not been used very much.
Interesting answer. I'm glad you asked that question.
Thank you. I think, because so many people are being told, but wait and see that these
it's all going to work out.
Are magically going to fix
magically
everything.
save things.
So there is a solution. Steffi, you've been working on this for a long time. Can you talk about the single-payer solution?
Yes. Well, the single-payer solution is sometimes called an expanded and improved Medicare for all. That is, everyone would be covered in a program like Medicare, only the single payer would eliminate all of the co-payments and deductibles in existing Medicare. And that it's sometimes called a single payer system. It's the type of system that they have in Canada and several Western European countries. You pay for the system out of taxes. Patient has complete free choice of doctor or hospital, and there's no co-payments, no deductibles for covered services. Nations with single-payer systems actually have lower health care costs than in the United States, largely because the administrative costs in a single-payer system is so much lower. When you just have one agency, kind of like Medicare or Social Security, that's paying all the doctor bills, that can give budgets to hospitals to pay all the hospital costs, you save several $100 billion a year on healthcare paperwork and administration, and that makes the entire healthcare system substantially more affordable for not just for individuals, but for the government, for society.
So, Steve Brill just did this lengthy article for Time magazine about healthcare costs, and he didn't come out for single payer, but he has this two sentences I want to read to you and get your reaction to. He says, "The real issue isn't whether we have a single payer or multi-payers. It's whether whoever pays has a fair chance in a fair market." What do you think of that?
Well, the idea of a market with, standard prices, that's a theoretical system that people are theorizing might be effective in controlling healthcare costs. That's not a system that exists anywhere. In contrast, the single-payer system with a single public system like Medicare has been tried in numerous other countries and has been shown to control costs, to provide access, to provide choice, to provide good health outcomes. So what Mr. Brill's advocating is something theoretical that he thinks would work, but that has yet to be proven in the real world.
Yeah, so single payer is not an experiment. It's been proven. It's been proven to work. But
it's evidence-based, you mean?
It is evidence-based. But people are, there's so much out in the media that frightens people away from it, and we hear, things like that. We'll have rationing under a single payer system. Can you address that a little bit for our listeners?
Well, certainly many European countries with single-payer systems have no waiting list of any kind. So it is possible to run a national health insurance system without waiting lists. The key is the decision about how much you're willing to spend, right? Because if you're trying to spend, only 6 or 7% of gross domestic product, you're probably going to end up with waiting lists. If you're willing to spend 11 or 12% of GDP, like many European nations are willing to spend, you're not going to get waiting lists. Here in the United States, we're already spending 17% of GDP on health care. And, we don't commonly have waiting lists, though I do want to point out that people do sometimes wait for care in the United States, particularly if they're trying to get primary care. It's a whole lot easier to get expensive specialty care without waiting in the United States than it is to get, your basic primary care to keep you well.
Yeah, we don't have a waiting list. We just have people dying.
People who can't get into it.
People don't bother getting online.
Right, yeah. We only have a few minutes left. Is there anything that you want to share with our listeners about how they can get involved or how we're going to get to the single-payer system?
Well, I mostly want to echo some of the material from the Strike Debt people. People are in debt, and it's not your fault if you're in debt. It's particularly not your fault if you're in debt because of a medical problem. This is unfair. No other developed nation forces people to go into debt because they get sick, and we need to be really thinking of moving toward a fair, efficient single-payer system so that no one ever has to go into debt because they had the misfortune of getting sick.
Right.
And people can read your work and a lot of other great stuff on the Physicians for the National Health Program website, pnhp.org.
Right.
They compile all the latest research on healthcare costs and single payer around the world, and they have a whole page. A lot of the Massachusetts stuff is also compiled there. If you go at PNHP/Massachusetts,
right.
you can get the Massachusetts updates too.
I think an excellent place to start is there's a whole section for people who are new to single payer that's very easy to understand. Healthcare Now, healthcare-now.org is a national grassroots group. You can find local group.
The challenge, of course, is the public is already with us. 2/3 of the public already support a single-payer system, and we can't get the government to consider it. And it says that's the real challenge, is the corruption and dysfunction of our government.
Yeah, well, absolutely. I think corporations now have veto power over a lot of what goes on in Washington. And in the health reform debate in 2009 and 2010, the private insurance industry exercised that veto power to get single payer off the table. So this is really about reclaiming American democracy.
That's right.
Sure that we, the people, have control over the political process.
Exactly.
And we can do that.
Great guest. Thank you very much.
Thank you so much for taking time to join us today.
It's my pleasure. Goodbye.
You're listening to Clearing the Fog, speaking truth to expose the forces of greed, and we're going out with Junkyard Empire. We want the people organized.
Can build the kind of
future we want.
The people together can overthrow the system. We got the love, uplift our brothers and our sisters. The people organized can build the kind of future we want.
This is Margaret Flowers.
And I'm Kevin Zeese. Join us every Monday morning at 11 a.m. for Clearing the Fog.
Speaking truth to expose the forces of greed.
Start the week with your eyes open.
The fog.
The forces of greed that spin news stories for the benefit of the 1%.
Each week we feature guests who are working to expose these truths and offer real solutions to the current crises we face.
Knowledge is power, and with knowledge you will be empowered to act, to shift the power to the people.
Monday mornings at 11 a.m. on weactradio.com or 1480 a.m.
You're listening to We Act Radio, WPWC 1480 AM, broadcasting live from Martin Luther King Jr. Avenue in D.C.
Roundup